Welcome back, Bravehearts. And today's, we call it a one a day, but we could be here for a while. It's called what? Medical manipulation. I'm here with my friend Bones. We're going to be talking about him in a few minutes. But I want to talk to you about something, and that's this. You know, I can remember a time, okay, when we wanted to be like the medical system, right? Okay, well, because they have so much power, right? But understand something. I don't want to ever be like the medical system. The medical system is in emergency care. And the reality is with the medical system, it's either their way or no way, okay? And I want to show you something here today. And I want to tell you this, that if you ever needed medical care in an emergency situation, is the only time that you would use them. If you're using the medical system for anything except emergency care, all right, you are going to become a 911 emergency. Now, let's look at it this way. I think that, wouldn't it be great if natural were to come with medical and medical were to come together with natural, and we were to come together and we were to use their so-called medical breakthroughs and then everything natural, because everything natural is what we're supposed to have, is everything normal. Now, I want to show you a picture here. Let me just show you this. Did you see this picture? What do you think of that? Do you see the arm? That's somebody's arm. Do you see the redness? Well, that's inflammation, that's scar tissue. Understand. Now, do you see the black, that black hand? Do you know what that black hand is? This is a lady, okay, and I know she wasn't well before she went. But anyways, guess what? She went and got a transfusion into her hand. And what happened was when they did the transfusion, they infected her hand. Now, what's the only thing that's really, truly going to give you permanent healing is what? Detoxification, okay, where you get rid of infection, so that the more infection you get rid of, the more toxins you get rid of, the more your immune system's going to come back. Because remember something, the more inflammation you have, the less immune system you have. I need you to get this. Now, let's understand something, that every disease is a symptom, and every disease is caused from infection. We won't talk about the emotional point of view of infection because everything happens psychological before biological. But the reality is this. First, you must have physical infection to have what? Inflammation. The more infection you have, the more inflammation you have. Now, what if you don't bring down the infection or don't stop what's causing the infection? Or what if you're trying to heal someone that is so badly infected because of their mind and their diet, and then your drugs no longer work? No longer work. Does anybody ever notice something? That people that are chronically ill, antibiotics don't work, okay? All right? Steroids don't work, okay? Injections don't work, okay? So they got to use stronger drugs, stronger medication until we get ourselves up into the big leagues of radiation and chemotherapy. Isn't it something? You know, when you start using different types of medications, they're not medications, they're toxins, to try to suppress or to numb out or to kill symptoms in the body, you know, sometimes that works. But what happens when you're dealing with an older woman who has had her immune system taken over due to so much infection in her body, so much inflammation? And then guess what? What if she is totally stressed out and always has been? You do know that's the difference between healing and not healing. You do know that when you're really stressed out, okay, look it. There are two protectors in life, okay? The one protector is called your immune system. The other protector is called your adrenals, right? So your immune system is going to protect you, okay? Protect the inside. Your adrenals are supposed to protect you from the outside. But what if you're an anxiety-ridden person? What if you're stressed out all the time? What if you have this feeling that if you're not on your guard and you're not in fight or flight mode, okay, that you're not going to be there when something goes wrong. Well, the reality is this is what happens. This is what happens. The more that you stress out, the more you dump adrenaline, cortisol into your body. The more acidic you become, the more inflammation you create, the more scar tissue you create, the more displaced calcium you create. And guess what? So this lady here, she got a transfusion and they did it into her hand to try to get rid of an infection. Now, this is our great medical system. That is her hand that you see is black that looks like charcoal. Now, they called me and they said, what can you do? Because they were told about Cellsonic. Yes, Cellsonic would help. It's the most powerful energy medicine device in the world. I also told them that they need to start wrapping where the hand is red, that's the inflammation, and where the hand is black, they'd have to soak it. And they'd have to continually soak it with things like C60, silver bullet, gel, okay? And then we'd have to use Cellsonic above the inflammation and then eventually start working down into the inflammation. But the reality is how do we get this far? How do we get this far? Where's the love? Where's the unconditional love? Where's the unconditional care? Where is that all gone? I got to tell you something right now, and I'm going to not go harping on it today, but I need you to take a look at this. That where the black starts, that's her wrist. Then you're coming into her hand, and then you can see her fingers. How does that happen with the great medical system? We'll keep an eye on it for you. Nobody's going to keep an eye on anything for you. Your chiropractor, your naturopath, your massage therapist, your physiotherapist, your medical doctor, your surgeon, nobody's keeping an eye on anything, trust me. Come back and see us in a few months, and guess what? If it hasn't healed, we're either going to have to cut something off or cut something out, or we're going to have to poison it. Okay? So understand this, that until you understand that you need to become your own practitioner, you need to become your own health care, okay, system. You need to know from the moment you rise until you close your eyes on how to make a what? An emotional decision that's to your benefit, a physical decision that's to your benefit, and to make choices that are high vibrational, right from the drink, from the food, to the people we hang around with. Now, I'm going to tell you, I'm not going to make any false claims, but the reality is miracles happen when you take massive personal action. So this is an older woman. She's got 2 daughters, and they're saying, well, how much will it cost? How much will it cost? Well, you know what? And it's not that my mother doesn't mean things to us, because she does, but we need to know how much it's going to cost, and you're not covered under medical. Well, has anybody ever noticed something? That if it's covered under medical and it's kind of quasi-natural, it doesn't work? Does it? You know, the last thing that I need to know is that I'm approved by the government, because now I know that I'm twisted and watered down. The next thing that I need to know this is, if I was ever, okay, going to be approved by your insurance plan, then that means that I have to be cozied right up with the medical system, which is never going to work. So understand something. This never needed to get to here. But what happens when you are so doctrinated into the medical care system that you'll actually let your hand get black like this? That you'll actually have family that are supposed to be logical thinkers, and this will actually happen? Okay, I'm not downing anyone. I'm just trying to tell you that the world's been screwed over. Okay? You know what? We just don't look outside. If you want something different, okay, then you're going to have to look for different. If you want something different, you're going to have to look for different. And if you want to be healthy for your whole life, then you're going to have to become your own doctor, your own practitioner. Now, I want to talk about something else here today. Yesterday we were talking about bones here, right? And guess what? Did you notice something, everybody? That the human body is made out of mainly what? Okay, as far as minerals it goes, it's calcium, right? And the reason why it's made out of calcium, because calcium is used to buffer down your blood so that you don't become too acidic. Because if you do, you'll go into a coma or die. Okay? Okay, calcium's used to actually go into your cells to actually buffer down inside the cells so that it doesn't become cancerous, which is basically stage 2, 3, 4 inflammation. And that's created because of what? Infection. And here's the deal. The more trouble that you have with inflammation, swelling, stiffness of joints, okay, and redness, is the more that you're out of balance and out of harmony with yourself. The more severe and stiff that your joints are, the more scar tissue you have, the more displaced calcium you have, the more you are heading towards osteoporosis. So when we're not in balance, we turn our tendons, our ligaments, our muscles into beef jerky. Do you ever eat beef jerky? Why don't you go chew on a piece? Go chew on a piece of beef jerky, okay? And guess what? It's pretty tough, isn't it? Well, that's what arthritis is, okay? That's what every dysfunctional situation in every muscle, every tendon, every ligament, every organ in your body. First, it becomes inflamed, like somebody threw it on the barbecue. Then it becomes dehydrated because of the inflammation, and we get scar tissue formation. So then you can call it a fibroid, you can call it a tumor, you could even call it a cyst. Okay, you can call it a lesion if it's in the brain. You can call it an adhesion if it's in your abdomen. But understand, it's a scar tissue issue. And the reality is that, guess what? Grandpa, are you okay? You're like walking like you're stiff as a board. Oh, I don't feel a thing. And that's because all that scar tissue and displaced calcium has wrapped itself around his nervous system and numbed him right out. And understand something, it doesn't matter what age you are, you can keep your flexibility, you can keep your circulation, you can keep your health until you decide to leave this planet. I don't know if you remember this, but I can remember this. You know, most of my relatives when I was younger, they used to fall asleep and leave this planet. They didn't suffer for 10 or 15 years, the last 10 or 15 years of their life. And understand something, why don't you just do me a favor and play a game with me? Why don't you ask everyone at a different age? You know, this is the deal. If you're 10 years old, you're on one drug. If you're 20 years old, you're on two. If you're 30, you're on three. If you're 40, you're on four. And if you're 50, you're on five. And does anybody know that was their program and that was planned? And understand something. The more drugs you're on, the more toxic you are. The more numbed out you are. Okay? And the more trouble you're going to get into because you stop feeling. Because drugs help you to numb out, don't they? They are called what? Painkillers? Anti-inflammatory, okay, antidepressants. Oh, but then there's another one, antidepressants. There is no such thing as an antidepressant. And actually, a major study was done about 6 months ago, and they found out that anybody that's on antidepressants, there's only one side effect, and that's the tendency to have visions of suicide. And that's why a week after now that you get prescribed antidepressants, they're supposed to call you up and ask you if you have tendencies of suicide. So the reality is what I want to tell you is this, is that you're not stupid. You're not dumb. You will become a brilliant practitioner, healthcare person for yourself when you decide to actually get brilliant beliefs and get rid of these dumb beliefs, okay, toxic beliefs, that you can't look after yourself and that you need someone that went to medical school that never studied health in their life. They studied cadavers. That's right. So, you know, whether you want to believe this or not, when you try to become a doctor, you study corpses more than you study live people. So it's kind of like you're working backwards. The reality is that we need to understand something. And get this. I need to train myself, to love myself, to honor myself, to respect myself, to protect myself. And if I can do that, look at until you have no negative symptoms in your body. I have no negative symptoms in my body. I do get tired, And if I eat crap, I feel like crap. But I have no diseases, I have no sickness, I have no allergies, I'm not on any medication, and anybody can do what I've done. And understand something, some people think that I'm a psycho and some people think I'm a genius. Well, I'm neither. Well, maybe I'm psycho. But the reality is I'm not a genius, I'm just logical. Why can't you just learn to be logical? Why can't you learn that if you need to have a love health zone, meaning that you don't bring anything into the house that's not toxic? If it's toxic, it doesn't come in. That's reality. Just something for you to think about. Something for you to think about this holiday season is saying no more than yes. Because almost everybody during a holiday season says yes to everything. It's like you step on their foot, their mouth drops open, and then you just can throw anything in it. And sometimes, actually, when we drink the wrong things, a lot of things come out that we shouldn't even say or do. And the reality is that let's see if we can have a sane holiday so that we don't have the whole world having COVID, so that we all get to put diapers on our face again. Wouldn't that be really good? And you know, you might say, well, he's a little sarcastic today, but the reality is that, guess what? Let's do it for the children. Let's show the children that the adults, the parents, the relatives, that people that are older are finally going to stand up. Wouldn't that be cool? Wouldn't that be cool to do that? Okay? It really would be. But let's talk about something here. And that is whatever your weak point is in your life, that's what's going to put you in a nursing home, that's what's going to put you in a hospital. So what is your weak point? Is it your hip? Is it your knee? Okay, what is it? Is it your digestion? Okay, is it the migraines? Okay, is it your blood sugar? Is it your high blood pressure? So whatever your symptom is, instead of going to a doctor and taking medication and telling them that, you know what, I don't care to feel this. I don't care if it's going on, just numb it out so I don't feel it and it doesn't exist. Well, it is existing. And that's why people who take, the more drugs you take, the more surgeries you gotta have. Because you're gonna turn into a beef jerky because you don't feel the pain, the inflammation anymore, but it's still going on. And you're barbecuing whatever that weak point is, that organ, that tissue, that tendon, that ligament, okay? Or you're crippling or breaking down the calcium so bad. I mean, guys, whether you're gonna believe this or not, but you can have the most severe osteoporosis, osteoarthritis, or rheumatoid arthritis, and it's all reversible. And I can tell you that. You can have a bunion and we can get rid of that. You can have arthritis in your toes where they're all cramped up like hammer toes. We'll do one treatment on you with Wolf non-surgical, and I will take your hammer toes from here to bring them out to there. How's that? And we'll take pictures before and after. I'll give you a money back guarantee. I'll tell you that if, you know, most people as they get older, their ankles don't move properly, and that's why they trip, that's why they fall. You know, if we were to go in here and work on what we call the horseshoe of the ankle and go in there and loosen up all the calcium deposits, the crystallization, and actually go in here and pull the scar tissue apart so there can be beautiful tendons and ligaments again. Understand, you'll have the flexibility you had when you were younger. Remember, every time that you lose flexibility, whether it's your ankle or it's your knee, it's all just displaced calcium, scar tissue crystallization. And I can guarantee you we can turn it back into a beautiful, normal joint with beautiful, healthy tendons, ligaments, and muscles. You know, just like how people will go and they'll go, you know what, I went to my chiropractor and he built me this new insole, okay, to try to help my feet and try to balance me out. You know what, that has got to be the dumbest thing. I don't care whether you're going to an osteopath or a chiropractor, okay? You remember something. At what point did you actually need that insole? What point did you need that special orthotic? Okay, you don't need it. What you need to do is you need to bring back the mobility in your joints. Bring back the flexibility, the tone, the circulation to all the tissues so you don't have these issues. Remember something. As you age and you get more scar tissue, calcium crystallization, you change, your foot changes shape. I have a healthy foot. I don't know if you can see this, but I don't have any joint problems. My foot is full, it's muscular, okay? I don't have any pain in my foot. I don't have any bunions. I don't have it where my joints are sticking out, okay? And then what you see in most people is the joint gets fat and knobby, and then the tendons and ligaments that run in between the joints, they are hardly even there. So you got these skinny little bones, these big fat joints that are calcium and scar tissue. I hope you're getting this, and that's almost every older person. You know, I'm going to tell you something. I talked to a gentleman this morning, and his toe joints, because, I guess because, I'm in Mexico, I don't like wearing shoes. I like to be grounded, and that's what it is, grounding. So I don't wear shoes. I don't wear socks. Geez, if I didn't have to wear clothes, I wouldn't wear clothes. I love freedom. I love freedom mentally, emotionally, physically, every which way. Okay, but I just know that if I didn't wear clothes, this show would probably crash and burn. The reality is guess what? You can have young-looking feet, young-looking hands, young-looking skin. You can be older and have muscle tone, okay? This is a bunch of BS, okay? Don't ever compare me to another 66-year-old person, because I don't look like it, I don't feel like it, I don't act like it. And when I'm 95 years old, I'm gonna look not much older than I am now, because I am learning to love and honor and respect myself more and more every day. I gotta tell you something, let me tell you the truth. I'm a little scattered, like I went out drinking last night, okay? I didn't go out drinking, but I'm scattered like I did. Okay, you're gonna go, are you crazy, Dr. Wolf? I guess I am, okay? All right, I had somebody visit, and they left these chocolate chip cookies there, and I didn't eat one, I didn't eat two, so we all get tired, we all get weak. I think I ate about 12 cookies. They're small, but they're chocolate chip. I haven't done that in a long time. I woke up this morning, and I still have a headache back here from those chocolate chip cookies. Sugar's a killer. Refined carbs is a killer, and God knows what else was in them. But the reality is I'm not gonna do that again. And so, I get it. But understand something, everyone. Do you get this? I can't, and I don't want to, and I never will. I'll never live with anybody that has toxic eating and drinking habits. Because are you gonna tell me that you're a beautiful spirit, that it doesn't change your vibration and doesn't change your moods, and that you're not moody? Are you gonna tell me that you're not moody? Are you gonna tell me that you're not moody after you've had a few drinks? Are you gonna tell me that you're not moody after you've had a bag of chips, that you've eaten the ice cream? Let me tell you something. There's gonna be more squabbling, more fights, more depression, okay? More anxiety and more sickness than we can shake a stick at. Come what? January the 6th. Why the 6th, Dr. Wolf? Well, because guess what? We go, wow, 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 drink, 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 eat, 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 go, 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 go. Once you slow down, that's when you have aches and pains all over. And then it puts you in bed where your body wants to give you diarrhea, fever, sweats, dripping nose, dripping everything out of any orifice. So by the time January 6th comes, if they're going to pull their little COVID stunt, they'll do it around the middle of January into February, and then they're going to tell you that the world's ending. Well, guess what? The world is ending the way that we know it, and the majority of the population in 30 years, I don't believe will exist even on the planet. If you take a look at things, what's going on, tell me I'm wrong. I'd like you to tell me I'm wrong. Just know this, 80%, actually they say it's 82%. 82% of the population is overweight. Did you know that if you are 10 pounds overweight, you're obese? Oh yeah, but they changed it. They changed it if you're 40 pounds overweight, now you're obese. Did you also know that the medical system every 5 to 7 years changes, and what they do is they go, okay, so let's take a look at 50-year-olds. Okay, so when you're 50, you got this. Oh wow, that's 5 new symptoms that we can add to the 50-year-old. So that's what a 50-year-old looks like, smells like, tastes like. So now, if you've got this going on, you're the average 50-year-old, which means you're doing good for your age. What a crock of crap. Okay, so understand something, 82% of the population is obese, but they're not obese because they changed the thing about obese that you're 40 pounds overweight if you're obese, and that's not true. Because when I was a kid, okay, when I was younger and I was even a teenager, it was 10 pounds overweight, you're obese. So how's that? Okay, so understand, they're gonna change things. Just like now, you can go to the mall and you can go into one of these places where you buy these tights because you wanna work out. And understand, I don't know the name of the companies or all these women's stores, but it's mainly women's stores. But they'll show a woman that's 250 pounds doing a headstand. Yeah, show me one that can do that, okay? Show me a woman that's 250 pounds. And understand something, how many people are gonna gain weight because of Christmas and because of New Year's? Not gonna gain weight, they're gonna gain, what are they gonna gain? Help me out here. They're going to gain toxicity and inflammation. Nobody's putting fat on. Fat cells are created to store inflammation and toxicity so you don't end up stroking out, having a heart attack, having a seizure, or becoming one big cancer situation. Well, you will become that eventually. And if you didn't have the fat cells storing all your toxicity, but let me tell you something. Don't you just love the advertisements? Big, bold, and beautiful. Yeah, she's definitely big, bold, and beautiful. She's got high blood pressure, she's got constipation, sometimes diarrhea, okay? All right, her moods are up and down. She's trying to balance her insulin, but that's not working very well. Now she's pre-diabetic, okay? And the reality is now she's having night sweats and fevers, and she's got aches and pains all over the place. So understand something, let's just really just try to keep a handle on things. Because the whole generation of lean and keen is over, okay? Because everybody's walking around like zombies because they're so toxic. You know, they're just having a way with us, aren't they? Okay, and they can do it so easily. And here's the deal. As time goes on, more and more sicknesses, diseases, which are just symptoms of being out of harmony with yourself, are gonna be so accepted. You know, there's no need for a child to have allergies or asthma. That's not true. Those are bowel problems. Oh, there's emotional attachment there. But even anything, hemorrhoids, you name it. But the biggest thing is what they want us all to become so inflamed, so infected, that we have such scar tissue issues and displaced calcium that we're gonna go for surgery. I'm gonna tell you something. It's like, how about every day? Every day, one of my Wolf non-surgical therapists is seeing somebody that is supposed to have surgery on their knees or on their hips or on their spines or on their wrists for carpal tunnel syndrome or for frozen shoulder, and in one treatment we prove that it's a lie. What does surgeons do? Surgery? So they're not going to say, I'm going to go see the top surgeon. Oh, well, you just go ahead and do that. You go see the top surgeon. And understand something. If it's not time for him to cut it, he'll tell you he'll keep an eye on it for you. He's not going to tell you that, you know, the only reason why you need surgery is because of the scar tissue and the displaced calcium that you could reverse easily. Okay? He's not going to tell you that because that's not where the money is. And also, you don't mess around with the medical system. You can be an almighty doctor, but you go ahead and start talking like there's an alternative out there. Remember the lady's hand I just showed you? Do you know how many doctors she's probably seen or specialists that did not tell her there was an alternative? This didn't have to get like this, but when you're only allowed to use what you're given for tools and you cannot look outside the medical system, understand something. You're going to be sold off by the pound, and you better buckle up, baby, because you're going to have a bumpy, painful ride for the rest of your life. And don't think that you're going to get the support from your family to venture off on your own to heal yourself, because that's not going to happen. It's not going to happen. I'm going to give you my phone number. It's 469-861-9454, or it's 855-900-4544, extension 5. I want the world to challenge me. You know why? I want you to challenge me, and I'll tell you why I want you to challenge me. Because you've been sold the wrong bill of goods when it comes to how amazing you are, okay, how powerful you are, and what kind of a healing machine that you are. And when somebody says to you from now on, Okay? We've never seen this before. This is rare. Don't fall for it. Do not fall for it. Okay? All right? Because as the environment changes and new toxins and new frequencies are added, there's going to be new diseases. Okay? You have to understand that. Okay, 90% of all the diseases have only came about in the last 90 years, and 90% of all the food that people eat have been invented in the last 90 years. So just use your logic brain just a little bit, please. And know this, return to nature, return to self-love, return to self-care. I mean, you did have it when you were a baby, but that got stripped from you pretty fast. So, I want you to understand something. You call me up, you challenge me, I'll tell you what I would do if I was in your situation. Can we move the questions over and find out if anybody has any questions? Now understand, can we move them right over so I can see them right over to the side, please? Now understand something. I know you think I'm putting medical system down. I'm not. I'm trying to tell you that they're treading where they don't belong in your daily life. Let me tell you something. Would you call someone a doctor if they didn't tell you how you could detoxify and cleanse your own body? Would you call somebody a doctor that doesn't believe that food matters? Would you call somebody a doctor that doesn't realize that blue light, okay, actually burns the brains and destroys the eyes? Would you actually call somebody a doctor that doesn't talk about your weight, okay, and accepts that you're not obese unless you're 40 pounds over? Is that what you call a doctor? What do you call a doctor? I'm going to go see my doctor. A doctor should be a teacher, and you should be becoming your own doctor. Okay, can we go to the very beginning of the questions, please? Please go to the beginning. Okay, let's go down slowly and see if we see anything. If you've got any questions, ask me, and if not, then I'm going to go and I'm going to be shooting some other videos. Okay, right there. Arthritis, 27 years, knees, feet, okay, tinnitus. Okay, first of all, I'm going to tell you something. Anybody that has 27 years of rheumatoid arthritis, knees, feet, okay, first of all, you've been locked up in the medical system so long that guess what? They own you. They own every part of you. Tinnitus, well, that's ringing of the ears because there's so much. I'm going to tell you something, and people don't realize this. Let me see here. Tomorrow, I've got to go do some video shooting at a place, and then I'm going to be back here, and then I'd say around, I'm going to be doing a show at 12 noon with Jim Gale on how to grow a proper garden, how to turn your lawn into a garden, so please join us, okay? It's called Gardens Everywhere. And then after I do that show, maybe around 3 o'clock, I'm going to come on here and I'm going to talk about how to get rid of infection and inflammation in the ears, the eyes, the nose, and the throat. Okay, guys? It'll take me about 30, 40 minutes to go through that, and you're going to want to know how to do it because the only reason why you're going to have all of this infection and all this inflammation is because, guess what? You didn't say no to all of the garbage that you're going to be putting into your mouth over Christmas. Because guess what? It's going to inflame a lot of orifices, right? From your mouth all the way to your rectum, actually. So what was I going to say here? Yes. So tinnitus, the ringing in the ears, that everybody's getting that now. And understand something. This is called the TMJ here. This is called the anger point. And if you were to feel it, go like this, everyone. Mine is smooth, and I can feel the muscle. With most people, the muscles become beef jerkier. There's a hard knot right here. Now you're going, yeah, but that has nothing to do with the ear. Oh, yes, it does. Yes, it does. And guess what else has to do with the ear? Every time that you go into fright, flight, fight, and most people never even come out of that, okay? They don't go back into a parasympathetic healing state. Don't you see the world's dying here? The people in the world are dying because they're full of panic, full of fear. They don't know how to calm down. So what happens is, right here is where the vagus nerve, and how many people have neck trouble? So if I've got neck problems, a stiff neck, if I've got a TMJ problem where it's nice and tight in here, or I can feel this really hard lump in here, and then I've got tightness in here, What, you think that's not pulling on in here? And then the reality is that with tinnitus, your ear is a cave. And it has moisture, but it also will get fungus very quickly. And if you're a type of person who does any dairy, does gluten, does things that are toxic, then guess what? We got mold growing, and we'll get infection, we'll get inflammation. I'm going to tell you something. A gentleman and his wife came here, and they were here about, 3 weeks ago. And anyways, every time he flies, and the ringing in his ears, he says he can't live with the ringing in his ears. He says, I can't live with this anymore. I need to come and see you. I heard that you can help me. But every time he flies, he'll be sick for 2 or 3 weeks. And meanwhile, he flies a lot. So his life is destroyed. So I said, well, if you come down here, I'll work on you. And I did. So what I did was I worked on all around his ear, but I came right up underneath the back, underneath the jaw, and I worked here on the TMJ. And then I opened up the neck right here. Now, I did that on both sides. Today I did this side, the left side. The next day I did the right side. How's this? So now we're looking at 4 weeks, okay? Now they're flying here in another 2 weeks and they're coming back, okay? And they're coming back because now they want their whole body done. And I told them that at your age, they're in their 50s, I said it would take about 30 hours of non-surgical work going through all your toe joints, your ankle, your knee, your hip, all the joints of the body. I said it'll be 30 to 40 hours. They go, that's just fantastic, because guess what, Dr. Wolf? I haven't had any ringing in my ears. I flew all the way home. I was never sick again. I have total movement in my neck, and all my headaches are gone. Now, does that happen every time? I'm not going to tell you it's going to happen every time. I'm going to tell you that our work with Wolf Non-Surgical is the most miraculous work in the world when it comes to body work. Chiropractic can't touch it, and it can't. In the last 2 courses, we've had 4 chiropractors come through, and these chiropractors were saying the same thing. I need to up my game. It's not good enough to just jam the joint back in place. Keep adjusting people every week, every week, every week, every week, and guess what? When you do Wolf Non-Surgical, when you adjust, it stays in place. It doesn't pop out anymore. Or you can just do Wolf Non-Surgical and not even do chiropractic anymore. Because guess what? It was the displaced calcium, the crystallization, and the scar tissue. Because every ligament, every muscle, every tendon, when it becomes scar tissue, it shrinks just a little bit. And that tension keeps pulling the joints out of place. So you go get your spine adjusted as much as you want, your hip adjusted as much as you want, your neck as much as you want. Okay? You keep on trying to force things back into alignment. Or you could, guess what? Untie the knot and make the tendon more elastic and make it the length it's supposed to be, so you don't keep on pulling your joints out of place. I already gave you my phone number, so don't hesitate if you want to call. Nobody seems to want to talk to me lately. I don't know. Maybe I'm just not that much fun. The reality is this. When I tell you to call me, I mean it. When I tell practitioners to call me, I'm challenging you not to challenge you to go to war. I'm challenging you that, guess what, together we can bring up our game. And if you're a body worker and you don't understand scar tissue, that surgery causes more scar tissue than anything else, and after you heal from any surgery, if you don't get Wolf Non-Surgical, then guess what? You're blocking off your circulation. You could grow a bloody tumor or a fibroid or an adhesion that'll choke off. You won't digest your food or assimilate it, or you won't have a bowel movement, or women with cesareans, guess what? They're all choked up in here, and let me tell you, or you'll grow roots off of that where you had the cesarean, and you'll grow roots 2 to 3 inches long, wrapping around your pubic bone, your bladder, your prostate. Not your prostate, but your fallopian tubes. Okay, so just know this. Surgery causes more scar tissue because it causes terrorism to the cells. They inflame so much, and they create so much scar tissue to try to protect themselves from the terrorist. Okay, So understand this, every body worker out there, I'm telling you, massage feels good, doesn't it? But it doesn't do much good when therapeutically. Chiropractic, yes, you want to have your spine straight, everybody does. But guess what? You let us go in and work on your spine for an hour to an hour and a half, and guess what? If you're 5 foot, I'm going to make you a ½ inch taller. If you are 5'8", I'm going to make you an inch taller. If you're 6 foot, we can make you an inch and a half to 2 inches taller. Okay, and we're making you taller because your discs have become beef jerky. So you could tell me that you're getting ready to go and have frozen shoulder and you need an operation again. It might be your first, second, or your third, and you're not going to go. The reality is this, is if we pull the fibers apart, no matter where it is in the human body, whether it's an organ, a tendon, a ligament, or muscle, then we're going to get the blood flow back in there, the circulation, and that scar tissue turns automatically back into actually beautiful connective tissue. You can get a fibroid tumor. Okay, well, we won't call it a tumor. They used to call a tumor something that was cancerous, and then a fibroid was something that was benign. Now they call everything a tumor because they want to scare the living crap out of you. Isn't that nice? You know what? It's all manipulation, medical manipulation. So the reality is here, I could get somebody with a fibroid tumor a fibroid. We'll just call it a fibroid. Get somebody with a fibroid, and that thing could be as big as a large orange. And within, like I said yesterday, 45 minutes, I should reduce the size of it by about 30%. Because you have to understand something. Inflammation, scar tissue formation, calcification. And that's like when you see somebody with a cancerous tumor, you're going to find out it's full of scar tissue and it also has a lot of calcium in it. So what if we were to try to get the calcium back in the bones and we were to try to get rid of the scar tissue? Depending on the actual tumor and how inflamed it is and how old it is will depend on the type of therapy that we're going to do. So all I'm trying to tell you here is this, is that you have to really take a look at, I'm made out of bone and I'm made out of muscle, which is tissue. Now, what if I didn't have any issues in my tissues? Well, then you're not going to have any issues in your bones, are you? Okay? Because remember something, and what if you didn't have any emotional issues where you actually were capable of actually processing your emotions with unconditional love for yourself and not reacting to people all the time anymore? Well, you'd have your life. So let's see if you can get through this holiday season and with a slight smile, and the things that used to bother you, let's see if you can just connect to your breath with a slight smile and they don't bother you. Because every time that you react, okay, the longer you stay there and the more you react, okay, the more you're going to be losing calcium, the more you're going to be turning your tissues into scar tissue, and the stiffer you're going to get and the less energy you're going to have. And that's how that works. Just know this, and I mean this in the best way, and I keep saying it because I really want you to understand that. Just so you know that you could name me a therapy, and I guarantee you I've went to school for it. There's hardly anything that I haven't gone to school for in the natural health field. And the reality is I've learned from all of those things. But unless you're turning scar tissue back into beautiful tissue again, putting the calcium back in the bones and melting the crystallization and teaching your patients to become their own practitioner, then I'm going to tell you, you're fraudulent. And the world will never, ever change. The world's never going to change. You know, we don't need drugs. We don't need surgery, except maybe in a sports accident or in a car accident. But understand something. Why don't you take a look and do some research and find out how many people go to surgery, and guess what? That problem they have has been going on for 10, 20, 30, 40, 50 years. Look at the suffering these people go through. Look at the suffering that everybody goes through, okay, before they have to give up pieces of their body, okay, before they have to have rods and screws and stents and mesh, okay, and implants, okay? Look at it. I just talked to a lady this morning, and man, she is pissed off. She watched a video of mine and gave me a call. She wasn't pissed off at me, though. Well, that was a change. But no, she wasn't pissed off at me. She said, can I get this pacemaker taken out? And I said, I can't tell you. I would never tell you something like that. Maybe you can find a surgeon that can tell you the truth or maybe pull this off. She said, I've just had this thing in now for 2 months, that's it. And when I watched your video, okay, and I said, holy crap, that's me. When I went to the doctor, okay, I had so much anxiety that when he tested my heart, he told me I needed a pacemaker. And of course I wasn't thinking. I got a pacemaker put in the next day, and then I realized, okay, that I was just under so much stress by the drama that happened in my family that I blew myself out. And now I've got this pacemaker. And I said, well, go back and talk to the surgeon, because I can't tell you. I mean, you know what? It's a lot easier to put something in than take it out. And the longer you leave something in, the harder it is to get it out, because scar tissue grows all around it. It's just like people that when they get mesh for an inguinal hernia, you know, believe it or not, most people that get mesh for an inguinal hernia, they got suckered, baby. Okay, think about this. You had a sliver in your foot or your hand. How'd that irritate you? So now you've got a big piece of plastic mesh, okay, that's in your abdomen, which is like not the right place to put mesh, trust me. So now the mesh goes in there, and then the body gets inflamed from it, so it makes all this scar tissue around it. Do you know how many people tear out right at the edge of the mesh? Do you know that you've just created a calcium scar tissue block there? Do you know what kind of problems you're going to have? Mesh is like rebar in cement. You can't get it back out after a while, that's for sure. And understand something, if you ever have an inguinal hernia, you're not going to get mesh. You're going to find a doctor that will use suture, dissolving suture. And guess what? If you need surgery, go that way. Do not allow them to put mesh in. They stopped doing suture because guess what? It costs them $20 to $25 to make the mesh. They make $2,500 to $5,000 to put it in. Once they put it in, the inflammation and the irritation from that mesh is going to cause you more problems. Oh, wait a minute. It's down here. Guess what? It could help you even create brain problems right to a tumor. It can cause pelvic problems. Understand that mesh is going to create so much infection, so much inflammation. Remember something, everything that you put a foreign object into your body, it's called a foreign object, okay? All right? Understand something. The joint you have can rebuild itself. The tendons, the ligaments, the bone, everything. Are you patient enough to do it? No. You've been taught to be impatient with yourself, impatient with everything. And that's why there'll always be tons of patients. There'll be always tons of patients. There'll be always tons of sick people. Because until you unconditionally love yourself, you won't have enough patience to give yourself time to learn something new. You think I'm kidding? How much does it take for you to become discouraged and give up on things? Oh, I can't do that. Oh, I can't do this. Oh, I've never been able to do this. Okay? Understand, you've been programmed to destroy yourself. And don't say you haven't. There's not a person on any platform right now listening to me that is totally honoring, loving, and respecting themselves. And you can go, yes, I am. Well, then I know that your subconscious just did the talking for you. Because last night I had Chips Ahoy. I never do that, okay? But oh my gosh, there they are, weak moment, feeling tired, and then I go and have one. Oh, that's delicious. Because I had 4-inch consciousness, and then today I had 30 feet of hell. And I'm telling you right now, do you notice that I'm not totally on my game today? No, but tomorrow I'll be on my game a lot better. When tomorrow we're going to go through eyes, ears, nose, and throat and how to turn around inflammatory problems so you don't go and think that you should take antibiotics for a sinus problem. Well, I'm going to take an antibiotic and go down 30 feet into my large intestine and blow up my good bacteria so that I can help to clear up my sinuses. What moron dreamt up that? What about an ear problem taking antibiotics? You know what? Do you actually think all this stuff works? All it does is cut off the gut-brain connection so you have no feeling. It numbs you out. You actually think it got rid of the infection? Well, to do that, you'd have to detoxify or stop bringing in that toxin, or come on, please. You know what? The reality is I don't care how much health courses you took in school, you don't know what health is. I'm going to tell you something right now. The medical system knows nothing about health, real health. Real health, okay? Not pretend health, okay? If it wasn't pretend, okay, then we wouldn't be sick like this. We've never been more sick in the whole history of humankind. Okay, all right? You do know that, right? And you do also know that we're on our 6th extinction, right? They don't need to do anything anymore. With 86% of the population having an autoimmune disease, 1, 2, 3, even 3 of them, okay? And the reality is it's such a joke, okay? Because guess what? 1 out of 2 people are going to deal with cancer in a lifetime, and most of them aren't going to make it. And then 1 out of 2 people are going to have heart disease. Well, that's the whole population, isn't it? Okay, and then right now, 86% of the population actually has pre-diabetes. They're pre-diabetic. Okay, do you want me to keep going with more illnesses? Okay, all right, what a mess. What a mess. And you want to know something? Okay, back when I was anywhere from around 6 to 12 years old, when somebody had diabetes, you know, you understood that they had an illness, right? And today you can have diabetes, you can have heart disease, you can have so many different diseases and conditions, and you can say to someone, how you doing? I'm doing great. And you know what? You know, everybody says they're doing great now because they're not in the hospital, okay, in emergency care. That's where we've come. Now you're doing great when you're not in the hospital in emergency care. Isn't that something? Yeah. You know, I just thought what I would try to do before the end of the year is rant and rave a little bit. And just kind of just put it out there, you know. And I do understand that only 1 out of 10,000 people are going to buy into my stuff completely, you know, and they'll be known as totally crazy. But the reality is here is let's see how often you can say no, how much you can keep a slight smile on your face with every drama that's going to happen between here and January the 6th. And I say January the 6th because by the time January 6th comes, there will be so much exhaustion, fatigue. Everybody that has any type of symptom, it's going to be blown right out. They're going to think they're dying because they're so infected and inflamed. Yeah, I'll tell you what, if you need to go to emergency care because you're addicted to it, don't be doing it after January 1st, because January and February, if they don't lock everything down with COVID, you probably won't be able to get into emergency anyways, because nobody knows how to love themselves properly, or very few people, right? Yes or no? How many people are truly in your family that actually have great health? Hi, Lori, I'm doing a live right now.
Oh, okay, you go ahead.
Okay.
And, just call me when you're done.
I will, sweetie. Well, I did get one caller. So the reality is I'm calling you up. I'm calling you up. I'm telling you that, guess what? You need to become your most powerful advocate. You need to become your protector. Mommy's not going to do it. Daddy's not going to do it. Your husband's not going to do it. Your wife is not going to do it. Your children aren't going to do it. And you're definitely not going to get the world doing it for you. Okay, because most natural health practitioners, okay, they're not willing to hold the line. They're also not willing to tell you the truth. You will see the World Healing and Training Center, okay, which is our clinic here. We train and we have people coming from all over the world. We will actually have real strategies, and those strategies will be, if you have this condition, we need you to come for 6 weeks. And because we're not going to let people just bop on in for 7 to 10 days. Because understand something, would you like to really heal something, reverse it, and actually become your own practitioner? How would it feel to know that you can be unconscious in your subconscious, but we have programmed you and brainwashed you that the only thing in here are respect, honor, and unconditional love for yourself. And guess what? Even if you're tired, even if, oh, well, that's not true. Last night I was tired and I went and ate those cookies. I guess you got to do something dumb every few months, don't you? Okay? All right? But the reality is I'll get over that really quick. But, you know, I said to my staff today at my meeting is I don't want to touch anything that is man-made or manipulated. And I can't. For us to pull off this world tour and for us to bring up the strategies of helping to truly heal people in the World Healing and Training Clinic, okay, we're going to have to be on the ball. We can't eat low vibrational foods, drink low vibrational drink, okay? We can't do things to numb ourselves out. We have to become high vibrational beings, living in the present moment and totally own it. And then taking a stand for everyone. Because people will come here, and even if they have a chronic disease or illness, they'll go, okay, hi, Dr. Wolf. I've got stage 3 cancer, and I've got 7 days off, and I'd like to come down and get rid of it. Oh, really? Really? Okay, really? So what we really want to do is want to teach people that you've got to change your personality to change your reality. So you've got to give us the time to do that and then implement where we can create that perfect day for you so that you can keep repeating that on an emotional and physical level. Whether you're talking about a knee problem, or whether you're talking about a tumor, or whether you're talking about eyesight problem or anything, it can be reversed. Everything can be reversed. Are you patient enough to learn how to love, honor, and respect yourself? And then hold the line when you go home and you're with your family that's still killing themselves. And what, they're not? They're not? Why don't you take a look at everybody in your family's cupboards, fridges. Take a look in their medicine cabinet. Take a look at what they do and what they eat and how they live. I'm wishing better for the world. And that's what I'm going to do. I'm going to wish better. I'm going to want better. I'm going to hold the line. And I'm going to continually hold the line for everybody out there. And understand something. This is not to get you to buy our products, but, you know, I'm bringing on a product that is the purest mineral concentrate, and it's got the highest electrical charge in it that this world has seen. And that'll be coming out in 8 weeks. I bring out a product maybe once every year, once every 2 or 3 years, and it really has to be the best on the planet. The reality is this, whatever you do in your life, I want you to look for the best because you deserve the best. I want you to look for the best relationship with yourself, the best relationship with everyone else. And understand, that means you're going to have to leave some people behind. What do you do if you love someone or care for someone and they don't love or care for themselves? Do you try to change them? What do? Do you just stay there and suffer and keep your own vibration low? Or do you learn that in life, you've got to let things go that are lower vibrational to let things in that are higher vibrational? Whether you're talking about food or drink or people, or even the things that you do in your spare time. What do you do in your spare time? Is it a waste of time? Or are you doing something that is making you feel like you're finding that true authentic self and you're really empowering yourself and going, wow, this is what living is. It's thriving, not surviving. Are you tired of being a survivor? Then do something different. Unconditionally love yourself and take care of yourself. Have a beautiful day, brave hearts. God bless. You know, it's not good enough to have the most powerful courses, treatments, and training. We want to deliver to you the adventure of a lifetime that's going to last a lifetime. And I'm going to take you on a little adventure right now and show you what we are going to deliver. What are we going to deliver? We are going to deliver the authentic you, the real you, the genius inside. How would you like to become not just the master of your mind, but the master of your body, the master of your life? You know what? The most important world is your world, and we're about to show you how to create it. Never limit yourself to beautiful, because that's what you are. Take a look at this beautiful place. We all deserve beauty in our life. You need to create a new program that is unlimited when it comes to things that are beautiful, things that make you happy, things that make you shine, things that make you feel excited. Let's get excited. What I've learned in my life is this: to be the change you wish to be the change you wish to see, Braveheart, you have to understand you take life one step at a time. Never lose your focus. Never lose your dream, because you are the dream maker. It's called image, but guess what? It's your imagination. The image that you hold creates the thought that you live with. That thought creates an emotion that creates a frequency, and we know that the invisible creates the physical. I mean, that's quite obvious. So be the power that you seek, and understand something, that all your thoughts matter. And guess what? Unless you're willing to take a look at those thoughts and retrain your brain, change your personality, you'll never change your reality, and your reality could become infinite. You were created by your creator to create. So let's create something amazing together. So tell me what you think of the destination that I came up with my imagination to hold the whole life coach certification for you. Understand something. It's all about beauty. It's all about adventure. It's all about stimulating the mind, okay? And understanding that your mind is unlimited. And that is what the Whole Life Coach certification is all about. In the Whole Life Coach certification, we are going to go deeper. We have people coming to us, professionals coming to us, from doctors to nurses to accountants to oil riggers to mothers that want to expand their life. And when they come here, they go, I need to learn to help my family, or I want to improve my business. But guess what? We get into their business. When they leave, they become the change that they wish to see, that they wish to be. They become the gift to the world, because when you can stay in the present, and you can't do that until you have unconditional love and care for yourself. And I'll tell you something right now. I have hardly even found 1 out of 1,000 practitioners, or even so-called whole life coaches, that can hold the present moment and own it and then give it as a gift. And this is what I'm going to give to you. And when you come here, this is where you're going to come into this room when you need to find alignment, you need to find balance, and you need to get back into your lion heart breath, because we're going to go deep into your heart, and we're going to become the spark that you seek. Come play, come stay, come train with us today. Understand something. I know we have fear, but understand, that's just false evidence appearing real. I get it. Stick your toe in, feel the water, but then I want you to dive right in, because you're the answer that you've been looking for. Let me teach you how to fly. What does that mean? First, love yourself, Braveheart. Let's take life in and win. I had a dream 3 years ago that I would live in Mexico, and I would have this training center, this teaching center, this treatment center that would touch the world. Your dreams are never too big. And when they start to create a little bit of anxiety, turn them into excitement. And get excited, because this is your life. And this, my friend, when you take on the dream of all dreams, and you realize that if you stay connected to your breath, that you can have it all. Do not let anybody take your breath away. Do not let anybody steal your dream, okay? Listen, God gave you imagination. This is your sandbox of life. Take your life back. Right now, we are teaching courses to people that have come from all over the world, and the government is saying you can't travel, you can't breathe, you can't have this, you can't come together. Yes, we will. And we will do it with unconditional love for each other. And we will learn to grow. We will not judge each other. We'll observe and see where we can support each other. But at the same time, we will hold the Braveheart line, because this is the only way that we can grow. So find your roar, because you're so much more. And learn this. You are the unconditional love that you've been looking for. You are the dream maker. I can't wait to see you. We want to become that small piece of the puzzle that brings your dream together. Thank you.